This is The Tay-Sachs Disorder by Aleeza, Lodhi, and Alyssa Studvent.
The first signs may appear from infancy to adulthood. There are three forms: infantile form, juvenile form, and late onset form. The first symptoms for infantile form appear within 3 to 6 months of age, and the child may start to have an exaggerated startle response to noise. They begin to lose milestones such as rolling and sitting and develop muscle weakness, which gradually leads to paralysis. They lose mental functions and become increasingly unresponsive to their surroundings. By 12 months of age, they begin to deteriorate more rapidly, developing blindness, seizures, and difficulty swallowing. Juvenile form is less common, and the symptoms may begin at any time, but most commonly between the ages 2 and 5. The child develops frequent infections, behavioral problems, and have a more slowly progressive loss of movement control, speech, and mental function. They also may begin to lose their vision. They spend several years having no responsiveness or awareness before passing away. The third is late onset form, and the symptoms may begin in childhood to adulthood. The person has neurological impairments that slowly are progressive and may lead to clumsiness and loss of coordination, muscle weakness, tremors, difficulty speaking or swallowing, and uncontrollable muscle spasms and movement. Many people eventually need mobility assistance. The first symptom is severe psychiatric disorder, and impaired intellect or dementia may or may not develop. This disorder is caused by a mutation in the HEXA gene. It is a type of lipid metabolism disorder and causes too much of a fatty substance to build up in the brain. This buildup destroys nerve cells, causing mental and physical problems. The HEXA gene provides instructions for making part of an enzyme called beta-hexosaminidase A, which plays a critical role in the brain and spinal cord. There are 78 mutations in the HEXA gene, which includes 65 single-base substitutions, 1 large and 10 small deletions, and 2 small insertions. The chromosome on which this disorder occurs is chromosome number 15. The name of the gene affected is the HEXA gene. The gene is changed because there are 45 of the single-base substitutions which cause missense mutations, and 39 of those are disease-causing. There are 6 nonsense mutations and 14 splice site lesions which result from single-base substitutions. There are 8 frame shift mutations arise from 6 deletions and 2 insertion type of lesions. The name of the protein the gene codes for is hexosaminidase A.
The normal function of the protein hexosaminidase is to break down a group of chemicals found in nerve cells known as gangliosides. Due to the mutation, the gangliosides are not broken down, and this leads to a buildup in nerve cells. The mutation relates to the symptoms heavily, as the mutated protein hexosaminidase A is not being produced enough to break down the gangliosides, which leads to a lessened cell communication signaling, causing gangliosides to build up in nerves, causing seizures, vision loss, hearing loss, and paralysis. Tay-Sachs is a chromosomal disorder on chromosome 15. Symptoms are present during autosomal recessive inheritance, but individuals can be heterozygous and be carriers for the disease. The pedigree on the side represents Tay-Sachs inheritance in a family grown off of heterozygous grandparents. The commonality of the Tay-Sachs disorder is 1 in 250 to 300 people in the general population. Although French Canadians, Cajuns from Louisiana, Old Order Amish in Pennsylvania, and those of Irish ancestry have a 1 in 50 chance of carrying the gene. Eastern Europeans with Jewish descent have about a 1 in 30 chance of carrying the variant gene, while 1 in 3,600 newborns are affected every year.
The tests used to diagnose this disorder are healthcare professionals look at a person's medical history, symptoms, physical exam, and laboratory test results in order to make a diagnosis. There are biomedical genetics tests and molecular genetics tests. These tests specifically test for beta-hexosaminidase subunit alpha. One test is a blood test, and that can be used to identify carriers of the HEXA gene change that causes Tay-Sachs disease and is used to check the levels of HEXA in the blood. The results would look like low or absent levels, which would indicate that the person has Tay-Sachs. The reasons for testing this particular disorder are because even though there is no cure for this disease, there are some treatments that can help manage symptoms and prevent complications. The best time to test for this disease would be prenatal testing.
Unfortunately, currently there is no cure for Tay-Sachs disorder and there is no way to prevent it. By the Mayo Clinic, treatments include medications such as anti-seizure medication, respiratory care such as chest physiotherapy, or medications to reduce saliva production. Nutrition and hydration such as feeding tubes are also used. Physical therapy is used to delay joint stiffness and the loss of function. Occupational therapy and speech-language therapy are also used for Tay-Sachs affected individuals.
The life expectancy for individuals with this disorder is around 5 years of age. Individuals with this disorder cannot have children, and the affected individuals do not live long enough to have children.
Currently, there is no successful treatment for individuals with Tay-Sachs and/or a cure. Many individuals will say that there's a need for therapeutic techniques which can be useful for treatment for the disease. Among the promising research, individuals use enzyme replacement therapy, the Jacob-Sheep model, substrate reduction therapy, and increasing of the activity of the B-hexosaminidase A gene. This treatment is a medical treatment where the replacement of enzymes are given to patients who suffer from chronic conditions resulting in deficiencies or malfunctions, such as individuals with Tay-Sachs. By receiving the enzyme replacements, the body should be able to successfully perform functions inhibited by the deficiency. The location for current research is unknown, but is most prevalent in the United States and European countries, as they hold the highest population of most affected individuals by the Tay-Sachs disorder. Thank you so much for following along.